Hi, my name is Rebecca Peacock, and I'll be presenting on vaginal yeast infections in women. Let me ask you a quick question. Have you ever experienced white discharge, burning, itching, or a discharge that looks similar to cottage cheese? If you have, you may have experienced a vaginal yeast infection. What is a yeast infection? A vaginal yeast infection is an infection that can happen inside or outside of the vagina. The outside of the vagina, that entire area, is called the vulva. I want to provide you with some helpful information that will help you be able to identify what are the causes, what are the symptoms, and how they can be treated. So let's start. Here we go. First, quick fact: 3 out of 4 women will have a yeast infection during the course of their lifetime. Also, almost half of women will experience 2 or more yeast infections. With that being said, let's look at some of the causes. We have a certain level of candida, which is a fungus that lives inside of our vagina. With that being said, if the pH balance in our vagina is disrupted, then there can be a significant increase in candida, which then causes a vaginal yeast infection. What causes this increase in candida? These are different causes: sex, antibiotics, soap, wearing tight clothing, stress, medications, diabetes, pregnancy, and even obesity. Well, now that we know the causes, let's talk about what are the symptoms. Symptoms can be mild or moderate to severe. Mild symptoms will be white, watery discharge. Like I mentioned earlier, it might kind of look similar to cottage cheese, which doesn't cause like a big cause for concern, but it's still something to pay attention to. More moderate to severe would be like intense itching that you really can't ignore, burning, pain during intercourse, pain when urinating, inflammation, and a reddish like appearance on the inside. So, what do you do when something like this happens? Well, if you've never had a yeast infection, don't self diagnose yourself because it could be another infection and you want to be for sure. So, you should go to your primary care provider. When you go there, what they'll do is they'll perform a vaginal exam. In this vaginal exam, they'll look for inflammation in the vagina. They'll look for the appearance of redness outside or inside, white spots, cracks on the skin, and they may use a speculum to do an internal exam where they look at your cervix to see if it's inflamed. All right, now that we know what the symptoms are and how to know for sure that it's a vaginal yeast infection, let's look at some treatments. All right, over the counter treatments. You can buy these basically at various stores like CVS, Walgreens, etc.